All right, continuing. Let's see. We got headaches. Come on, make it bigger. Don't do that. Blow it up. Nausea and vomiting. Sudden, reoccurring episodes of nausea and vomiting, particularly absent of gastrointestinal issues. Changes in mental status. This can range from irritability, confusion, lethargy, drowsiness, seizures. Onset seizures. Increased frequency of seizures in patients with a history of epilepsy. Vision problems, blurred vision, or other visual disturbances. Balance and gait issues, difficulty, unsteady gait, and sudden decline in coordination. Bulging fontanelles, soft spots on the baby's head. This is when a shunt is used. A shunt is a medical device that's surgically implanted to help excess cerebrospinal fluid from the brain to another part of the body. Typically, the abdomen. Shunt failure can lead to a buildup of cerebrospinal fluid in the brain, which can be a medical emergency requiring immediate attention. Signs and symptoms of the shunt failure may include all of these things that I just quoted. Are we seeing the screen, though? That's the question. Now we're seeing it. I really wish I could get rid of this. Can I get rid of this? Whatever. All right, swelling or redness along the shunt track. This could be shunt infection, could also cause a fever. The patient may have an elevated body temperature. MONA, acronym for morphine, oxygen, nitroglycerin, and aspirin. Everything that you want to do whenever there is a acute coronary syndrome or heart attack. STEMI, systematic tachycardia. No. STEMI is ST elevation of myocardial infarction. So morphine, administration of morphine can help alleviate chest pain and reduce anxiety in the heart attack patients. How much would we give? Let's look that up. Let's see if I can look it up without messing up this. Here we go, yeah. Morphine sulfate in pain management. No. Acute abdominal pain. I don't know if that could be heart attack. Cardiac STEMI, adult cardiac STEMI. We are going to give 1 to 2 milligrams increment IV push every 3 to 5 minutes, up to a max dose of 5 milligrams systolic. Blood pressure must be greater than 100 millimeters Hg. So as long as they're over 100, we can give morphine up to 5 milligrams, and they might have a make sure they're not allergic to morphine. And they might have a nausea reaction to it, in which case we would give Zofran. How much Zofran would we give? It's odonostrone. How do you spell that? Whatever. Zofran. Come on, man. I think I'm here. It's just my screen's so blown up. 4 milligrams IV if they have nausea and vomiting. So 2 to 4 milligrams, 2 milligrams morphine, up to 5 milligrams max, but we're not going to give them 5 right off the bat. And then we would give 4 milligrams IV push, and my screen just killed me. Let's reconnect. Come on. All right, we're back. Oxygen. Supplemental oxygen is given to patients who are experiencing low oxygen levels for respiratory distress during a heart attack. Obviously, the blood is not being pumped through the system of the body as much as it should be because the heart is suffering. That being said, we can put more oxygen cells for the hemoglobins that are making it through, just to boost the chance that all the cells are getting oxygenated. However, too much oxygen creates free radicals. Free radicals means that there's too many electrical charges. I forget if it's either positive charges or negative charges, but it basically creates unstable ions in the cells that are going to cause reactions through the body. Pressure waves from explosions or blast waves, also known as shock waves, rapid increases in air pressure that propagate outward to the point of detonation. They can cause significant damage to structures, serious injuries in peoples within the blast radius. And here's some key points. So the primary blast, so you have a grenade, the grenade goes off, boom. Primary blast is that shock wave that goes out. You hear it, you feel it. It creates a vibration in the air. High pressure wave moves outward at supersonic speeds. This wave can cause immediate injuries to internal organs and individuals close to the explosion. That vibration, now your lung is vibrating, now your heart's vibrating, everything just took some damage. Your secondary blast effect. So it creates a secondary blast effect, such as the flying debris. The grenade, the pineapple grenade, has little divots in it. That stereotypical grenade look is so it can blast apart into more shards. That would be the secondary blast, that metal debris that's coming and shredding anything that it comes in contact with. Cause penetrating injuries. Tertiary blast effects are the result of individuals that are being thrown by the force of the explosion. So if you jump on top of a grenade and it plops you up in the air, that is the tertiary blast effect once you come back down, or if you hit the ceiling. Quaternary effect include other injuries and illnesses that are not caused directly by the blast wave. It could be like respiratory injuries from toxic substances. If you had a sarin gas grenade, of course, it doesn't really explode, so I guess a nuke would be a better explanation. The nuclear fallout would be the quaternary blast effect. The blast radius is the area around the explosion in which people, structures are at risk of being affected by the blast wave and other blast-related effects. The size of the blast radius depends on the size and type of explosive device. Emergency responders and healthcare providers must be prepared to manage the blast injuries effectively, and includes triaging patients past the severity of these injuries. Protective measures, you got cover, you got concealment. Cover is so someone can't see you, doesn't really do anything. It's like being hidden in the grass. No, wait, that's concealment. Concealment would be being hidden in the grass, but cover is actually being behind like a steel door or something. When an explosion occurs, the primary blast wave propagates outward. Yes, we know that. Secondary debris, here we go. Sucking effect of the blast wind can draw in debris and objects from the surrounding area back towards the blast site. So you have like a vacuum that's created when something explodes. You can see this in water. Whenever there's an explosion in the water, because it's more thick and viscous than air, you see like a bubble, and then it pulls everything back in towards it. Secondary debris. Yep, flying objects and shrapnel. Building damage. So rapid change in pressure can cause structural damage to building, especially if there's a weakness, vulnerabilities in their design. Injuries to the lungs. There is negative pressure that can cause rapid changes in air pressure, which can then lead to injuries of the lungs, respiratory system, in individuals who are close to the explosion. Ear injuries. The sudden pressure change can also cause damage to the ears, including tympanic membrane rupture, hearing loss. People that are pulled towards the blast, in extreme cases, the negative pressure can be strong enough to pull people or objects back towards the epicenter of the explosion, leading to additional injuries. Amazon. Sweet. I guess that's my Jeep plates. Pre-hospital care, here's a list of the 12 cranial nerves along with their functions. Perfect. I wish I had a picture of this. So olfactory. That's your sense of smell that's in your nose. Your optics, there's like 6 different nerves that have stuff to do with your eyes. It's pretty crazy. But optic nerve is one of your primary ones, responsible for vision, carrying visual information from the eyes to the brain. Your oculomotor controls most of your eye movements, so that's 2, including raising your eyelids and adjusting the size of the pupils. Trochlear, primary movement of the eyes, so I guess we have 2 that are primary. Let's see how that is. Specifically moving the eyes downward and laterally. Trigeminally, so the word trigeminally kind of uses a lot of your mouth just to say it. That's kind of a key, so it has to do chewing, not just that though. So your maxillary is your upper, and then I think your ophthalmic is it's weird because like your face is divided into nerves. Like all of this is a nerve. That's your ophthalmic. Is that it? What does that say? Yeah, ophthalmic. So like that has to do with eyes too. Then your maxillary, your maxilla is like just as if you had a mustache that stretches all the way around here, and everything below it, your mandibular, responsible for facial sensations, touch, pain, temperature, and jaw movement. So trigeminal, there's like three in your head. Adducens or abducens, I'm not sure how to say that, controls the lateral movement of the eyes. Boom, we got more for the eyes. I told you the eyes are taking over all of the nerves. Facial, responsible for facial expressions, taste, sensations, anterior, 2/3 of the tongue, and salivary gland functions. I think the tongue has another one too. Vestibulocochlear, also known as the auditory nerve, responsible for hearing and balance. So think of your cochlea in your ear, vestibulocochlear, for auditory and hearing. Glossopharyngeal. Pharyngeal, we know that's where the throat's at. Glosso, I don't know, think of glossary for like words. I'm pretty sure that everything is like related to the Latin language. Maybe I don't know anything, but that's my assumption. It's involved in taste sensations from the posterior third of the tongue as well as swallowing and salivary gland function. The vagus, so this regulates several autonomic functions, including heart rate, digestion, respiratory rate. It also is involved in speech and swallowing as well. Vagus is a lot of things. You can stimulate it whenever, that's another conversation. Accessory controls the neck and shoulder movements. So this is, your neck, shoulder movements. Hypoglossal, more with the mouth, responsible for tongue movement, involved in speech and swallowing. So there's your run through. According to Starling's law, the more myocardial fibers that are stretched due to an increase in the volume of blood filling the heart during diastole, the relaxation phase of the cardiac cycle, the greater the force of contraction during systole, the contraction phase. In simpler terms, more blood that enters the heart during diastole is the more forcefully the heart will pump during systole. Well, yeah, that makes sense. Harder you push one, the harder you push the other. But this is Starling's law. I guess Starling came up with that. Frank Starling mechanism allows the heart to adapt to changes in venous return, ensuring that cardiac output matches the body's circulatory needs. For example, during exercise, your increased venous return leads to a greater preload, which in turn causes the heart to contract more forcefully, thereby increasing cardiac output to meet the body's increase for demand of oxygen and nutrients. So preload is the amount of blood that is going into your heart. It's about to go in, not there yet. So during exercise, increase venous return. Your veins always go to the heart. Your arteries go away from the heart. If you cut open an artery, you're going to see bright red blood because it's just now coming out of the heart to feed the rest of the body oxygen. Venous blood is going to be darker because there's very limited oxygen in it. So that is preload, your body's increasing venous return through the Frank Starling mechanism, which then causes the heart to contract more forcefully. If you encounter a patient with an evisceration, it's essential to follow the general steps for initial management until you get definitive care to your hospital. All right, evisceration. We're not going to shove the guts back in. Terrible idea. You don't know what order or form they go in. You're going to do more damage than good. So we're going to get an abdominal pad, fat abdominal dressing. That's going to be sealed, so it's sterile. And then probably soak it with some saline as well. Just cover that up. Wrap it with some Coban. Coban. Maintain scene safety. Okay, so make sure that Michael Myers isn't still in the closet, ready to just like rip you open next. So make sure your scene is safe. Call for advanced medical help. We are advanced medical help. Assess ABCs, of course. So make sure that your patient is breathing. That's always how it starts. If they're unconscious and laying there with their guts out, we're going to check their circulation. We're going to check it up here. Hopefully they're not bleeding out of this, but who knows? So check your CABs, ABCs. Do basic life support first. Always start with that. Minimize contamination, avoid direct contact with exposed organs, cover eviscerated organs with a clean, sterile, preferably moist, non-adherent pad such as a saline-soaked gauze. I'm on top of this. Let's go. Moist to reduce the risk of further contamination. Positioning. Position the patient carefully. Keep the patient lying flat on their back with their knees bent in a supine position. This position will help minimize strain on the abdominal muscles and reduce risk for further organ exposure. Knees bent, supine position. All right. So like dead bug, I guess. Prevent heart heat loss. Cover the patient with a clean, dry blanket. Yep. So you want to keep them from getting hypothermic. Same as heat damage, burns. Whenever we're regulating burn care. Comfort reassurance. Make sure that you tell them that. Don't tell them it's going to be okay if it's not. But give them reassurance. Avoid fluids by mouth. Do not give them anything to drink orally. They may need surgery, and we don't want to mess up the anesthesia. Monitor your vital signs and continuously monitor patients' vital signs as well, including heart rate, blood pressure, respiratory rate. Yes. All right, brief overview of the sympathetic and parasympathetic nervous system. Sympathetic. Sympathetic is to, what is sympathetic? Sympathetic is fight or flight, or also bang. All right, so fun fact. So whenever you're having an erection, or the female version of that, whenever the reproductive system, it swells up, it gets ready for some fun. Basically, that is your parasympathetic. That is your relaxing nerve. So you can't get it on unless you relax first. But whenever you orgasm, that's using your sympathetic nervous system, which is crazy because it's like both of it's sex, but it uses both of the nervous systems of the body. I don't know, it's crazy. So like right as you get there, I guess your sympathetic turns on, your heart rate shoots through the roof, contractibility, all of that stuff. Anyway, what does this have to say about that? So yeah, fight or flight is your sympathetic, prepares the body to respond for a stressful emergency or situation. Activation of danger, exercise, or any situation that requires increased physical or mental effort. Response in the sinus nervous system. What is SNS? Cerebral? No. Sensory nervous system increases rate, so it's going to dilate your pupils. Basically, it's going to let in more light. It's like, let's see like what is happening right now. Your body's like, let me see it. Let me see everything. So your eyes are going to dilate. It's going to redirect blood flow to the muscles and inhibit digestive processes. So like if you ever get nervous before like a speech or I don't know, something like that, your body's like, we don't got time to digest food. We got to go. We got to fight or flight. Stress hormones such as norepinephrine, adrenaline, and regular epinephrine. So you're going to get a release of all that. So like whenever I remember I'd be rowing boats, that moment right before they're going to pop the starting gun, I remember being in the boat, just heart pounding, my body surging epinephrine, like my boat's getting across the line before any of the other schools are. And then UCF flipped their boat. That was hilarious. Parasympathetic nervous system. So this is your relax, rest, and digest. Because it promotes relaxation and supports normal bodily functions during rest and recovery. Activation. It is activated at the body of a state of rest and relaxation, or when it is not under stress. Responds to the PNS, peripheral nervous system. So it's going to slow your heart rate, constrict the pupils, stimulates digestive processes, and promotes function like urination, defecation, and conserves energy. It helps the body recover from stressful situations. So like if you're taking a benzodiazepine or a narcotic, and it's basically going to activate the parasympathetic nervous system. That's why we see the constricted pinpoint pupils. It's going to cause that to happen. Whereas like mushrooms activate the sympathetic. Which one activates sympathetic? Fentanyl? always get my drugs mixed up. But one of them dilates the pupils and one of them's pinpoint. So your narcotics that you'd use Narcan, naloxone, you're going to get constricted pinpoint pupils. Ventral anterior, definition of ventral refers to the front anterior aspect of the body or body part in humans. The ventral is the belly or abdominal side. So you have the chest, that's your thoracic cavity, is ventral to your back, your dorsal side, which then is located on the front side of the body. Your dorsal is your posterior. On the other hand, refers to the back or posterior aspect of the body part. In humans, the dorsal is the back, like the dorsal fin of a dolphin. Your spinal cord is located in your dorsal cavity of your body because it is found on the backside, protected by a vertebral column, your backbone. Anatomical terminology. Wow, we haven't even started on this. Let's take a break. I'm hungry.